I think there are a couple of strong components. One is the scope of what you learn, because we do everything from diabetic foot care, routine care, all the way up to leg lengthening, and it's odd that you would get all of that in one program. And I think another strong point is our faculty. Our faculty is very dedicated. I've often said that watching somebody come in and starting their program a little bit unsure of themselves, not really knowing what they know or what they don't know, and then watching them go through the 3 years of the program, building their confidence, is always a pleasure to see. I would like people who are applying to residencies right now to know that I personally wish I was in their shoes as opposed to just nearing the ending of practice, that there are so many exciting things going on right now, even in this time of uncertainty, that I wish I was just starting out and not close to finishing.
We do journal club every Thursday of the week. It's basically a sacred time frame for the residents. They don't get pulled out of rotations or to cover cases. They're basically there just for the didactic session. We attempt to go over subjects that the residents prepare for and give a presentation on. And then we really try to basically have the residents find journals that at least deal with some type of controversy within the subject. And that tends to stimulate some pretty significant and nice discussion on both sides.
I decided to come to Lourdes Hospital, and part of its appeal was the opportunity that it presented to the residents in terms of their clinics. And while a clinic might not be the most exciting aspect coming into a residency program, from the perspective of the student, we're all thinking about our surgeries and how to be surgically oriented. It's a crucial step in our development, and one of the advantages we have is being able to work up our patients from start to finish, from diagnosis to preoperative planning to postoperative care.
I chose Lourdes as my residency program because of the confidence the second and third years showed during my externship. They showed immense confidence in the OR and with their surgical technique and abilities.
Dr. Laporta was also inspirational to come here. Just watching him lecture or work in the operating room was just motivational. His passion for the podiatry program and to be innovative in the operating room with new cutting-edge technology was something I had never seen anywhere else.
When I came here, I noted how they take an approach to every foot and ankle pathology, focusing on deformity planning and using that to get the best outcome for the patient. This includes biomechanics and looking in depth at every patient's pathology before we operate.
Yeah, coming in from day one, the attendings really want you to get your hands in on the cases, really learn, the surgical dissections, the surgical techniques, and really understand the treatment protocols. Same with the postoperative protocols.
Growing up, I've always been very shy and very reserved. Now, as a third-year resident, I feel more confident evaluating, treating, diagnosing patients, interacting with other residents with almost complete ease.
We love to have students with us each month, and we enjoy having externships. When the students come here, they're provided housing for the month, and they're assigned to do activities on all day with the residents. So if the residents are in surgery, if they're in clinic, if they're doing academics, so are the students. They're very involved in everything. So they participate in all aspects of residency life as a student. They have a great opportunity to learn a lot from all of the attendings and from the residents here at our program. During that month, they can experience what resident life is like, and they offer us a presentation at the end of the month based on a topic that they're interested in and they'd like to learn more about. We take that highly into consideration when we're interviewing for prospective residents, but we also interview people who haven't had the chance to extern or visit, and we're very open to that as well.
I completed my residency program here in Binghamton, and I'm now an attending at Lourdes Hospital employed by Lourdes Ascension Health. One of the things that I think is excellent about this residency program is that I feel that it prepared me to be ready to take on anything when I completed my residency training. You can guarantee that you'll leave here and be prepared to face anything in your practice.